Hello, YouTube world. My family, friends, subscribers, and viewers. Welcome back to Rebirth. Now, today, we are going to have something that has been bothering me for many years, and it also have an effect on other African Americans as well. But as your host today, I am coming to you with this topic, and it is some deadly diseases affecting African Americans. Like I said before, this platform is about health, and is also going to focus on the health disparities among minorities, especially African Americans. So, without further ado, let's step right into it. We're going to talk about, first of all, cancer. Now, African Americans are more likely to die from lung cancer more than any other race. And the black male is at a higher risk for lung cancer than his black female counterpart. Now, when we look at cancer as a blanket, when we look at a broad spectrum of it, cancer is a killer to all people, not singling out anyone, all people. But in the healthcare arena, there is a focus on minorities because of the healthcare disparities that they're suffering from. And with those many factors that leads up to this cancer, in the African American community, there are many factors that causes this problem. And we have to always put first the ideal of socioeconomic status. Because without the proper resources, there's nothing too much you can do to head or block or cut off some of the issues that we're having that causes a high rate of cancer in our communities. Black men have a 40% higher cancer mortality rate than white men. Black women have a 20% higher cancer mortality rate than white women. Now, this information is coming from American Cancer Society, in which they do their research as well. And in their findings, this is the data that they're receiving and they're pulling up after years of research. Among African Americans, 2019, nearly 203,000 new cases of cancer has been reported. And they also, within that number, 73,030 deaths. A lot of people. There's a lot of things that we can do to prevent a lot of the problems that we're having with this disparity. But are we willing to do it as individuals? Because that's where we come in at. How do we value our own life as African Americans or minorities? How do we value our own life, and what are we willing to do to make a better life and live longer, with or without cancer? What are we willing to do? The major contributor that is linked to cancer among blacks are cigarette smoking, according to the National Center for Biotechnology Information. I recently did a video on nicotine, vaping, cigarettes, e-cigarettes. Caught a little flack on it, but guess what? Doesn't bother me. Here's the point. What are you willing to do about your health? That's the question. Not about what someone else say you should do. But what are you willing to do about your health? This is a cry out to all minorities. Focusing on African Americans in this video, but all minorities. What are you willing to do? Think about it. Are we going to just allow ourselves to drift off into this world where we think we're invincible? We're not. Think about the contributing factors. There are more. Blacks are 2 to 4 times more likely to suffer from sarcoidosis. Don't know if any of you heard of sarcoidosis, but it is more severe. It brings more severe symptoms. And this disease is 16 more times deadlier for blacks than it is for whites. This disease has an unknown origin. Still focusing on sarcoidosis. It has an unknown origin and it's very rare. Remember, its primary target is the lungs. Although other organs, it will spread throughout the body to other organs. So, sarcoidosis is very deadly. And that disease can also contribute to the deaths of African Americans at a higher rate than it would white Americans. When it's affecting the body, it does not exclude causing different types of symptoms like rash. You would see like lesion looking like rash on the back, shoulders, parts of the body, sides. It will surface on the body like that. Eye redness causes eye disease. Coughing, chest pain, even congestion. This is what sarcoidosis can do to you. This is an awareness cry out to the minorities in this world, focusing on right now African Americans. Open your eyes. Start taking care of yourself. Stop saying that I can eat anything I want. Stop thinking that you can smoke anytime you want. Stop thinking that you are invincible. You're not. We're tough, but not invincible. Treatment can help. When you go to treatment for sarcoidosis, it can help. But the underlying truth, there's no cure. There's no cure for sarcoidosis. Research has shown links between obesity and cancer. Increased rates of certain cancers in people, especially young people or people younger than 50 years of age. And there are barriers to cancer care. And this is what I was speaking of earlier. When you're among the minority class that are fighting and trying to make ends meet, your socioeconomic status is not where you want it to be. That means you cannot get the health care that you deserve because you cannot afford different types of insurance that has the coverage that you need when you go into the doctor for specialized care. You can't get it because guess what? Now you're searching around for different doctors in a network that you're only provided with based on how much money you can afford to spend on an insurance package. That's the reason why they talk about socioeconomic status. This is a contributing factor. Race, our ethnicity, our color, our Afrocentricnism is a factor. Who knows what doctor you run into that has showing less care about your illnesses when you walk through the door. Nurses who may show less care for your illnesses when you walk through the door, doing proper intake, just doing an intake. Because it's true. That's part of the disparities that we're dealing with. Not only African Americans, like I said, minority. It can be an Asian American going into a doctor office, and there may be a few nurses or maybe a doctor in there that don't too much care for Asians. So the focus may not be as great. The desire to provide care may not be at a high level, and the quality drops. These are the things that we're dealing with. This is reality. This is what's going on. So when we look at those healthcare barriers, we have to think about poverty, race, where people live, geographic location. Some of the best doctors will not work in certain areas. They want to go to the Hollywood place. They want to go to the high society place where they can make the big bucks. And that's their right. They can do that if they want to. But it does cause health disparities because sometimes these are the best of the best going to the areas where they're going to get paid the most. And then, you end up with people that may not have a high level of care towards you because of your ethnicity. And then, hey, you're not getting proper care. You're not getting quality care. You're not getting the best care. We will run into that many times. So this is not to say that all doesn't care. All physicians, all healthcare professionals do not care. I'm saying that there are some out there that will treat you or provide to you quality care based on what you look like. It happens. So just a little note there. This is statistics that has been dropped based on research, based on lawsuits, based on people's finding that do this for a living, always looking for the truth. There's nothing wrong with that. So when we move away from cancer, which we covered, the next one I want to talk about is heart disease. Cardiovascular disease, far most, is the number one killer among Americans, bar none. But there's a stigma there when it comes to African Americans. Again, nonetheless, this disease caused the death in a much higher rate in African Americans than any other race. Heart disease. African Americans have a disproportionately higher risk of chronic conditions such as cardiovascular disease, type 2 diabetes, hypertension than any other ethnic group, any other race. The reason for these disparities in disease risk and mortality are multifunctional. And it's also factual. Differential healthcare access. The access to care is one of the things Obama focused on when he was in the seat of the commander in chief. And although the Obamacare plan wasn't perfect, let me tell you something, it opened doors for access, more access. Only thing we had to do was take advantage of it to better our health. But he did do that. When you talk about access and quality care, you need that. You need to focus on the environment in which a group of people coming out of, living in and out of, working, whether it's the south side or the north side of town, east side or the west side of town, of their poor conditions. Do the city go through and clean up? Do things like that happen? Do you have clean parks in that area? All these things are contributors to health. Neighborhood influence, persistent racial discrimination, health behaviors such as diet, smoking, socioeconomic status, genetic variations has been also hypothesized as contributors to African American risk to cardiovascular disease. All those things play a role in whether or not you can maintain a level of treatment to keep you well or to even prevent the disease. I like to lean towards prevention. And this is the reason why I raise the awareness. Prevention is your first option. Those of you that are already there with heart disease, I pray that you take the necessary precautions as far as how well you're eating. Take a look at your diet, take a look at your surroundings, take a look at how much you're getting good exercise, how much exercise. You don't want to overdo it, then you don't want to underdo it. You don't want to get out there doing the last minute stuff. Oh, here I am and I'm about to this or that. And so now you're running and ripping and trying to do the most. We don't want you there. We want you just doing what you're supposed to do to maintain good health. As far as prevention, you need to do what you need to do to be aware of your background, your genetics, what your grandparents, your parents, aunties, uncles, were they diabetics, were they this, were they that. You want to make sure that you have knowledge of those things so that you would know how to move forward in your own life in preventing heart disease or taking care of yourself, better care of yourself if you already have it. It's not too late. It's not too late. So, what are some behaviors that can increase the risk of heart disease in your life? First of all, if you're not getting enough exercise, it doesn't take a whole lot. You don't have to be one of those millennials that they hit the gym 3-4 times a week. They're there. They're always exercising, because now millennials, they are more focused on what they look like. Most millennials are saying, oh, I don't want to be fat. I don't want to be overweight, or I don't want to look like this, or I don't want to look like that. I want the perfect body shape, which there's no such thing, but we have people that think they do have it. But nonetheless, that's what those millennials are doing. They're doing it more so than people my age and you know, and older or what have you. They are really into fitness. And that is a good thing, because when you have women that are pregnant, carrying a child, and they're not concerned about what they put in their body, they harm the child. Believe it or not, those of you, I know you know it, a lot of you know it, but just saying that even the slightest things that you don't do to take care of yourself, it can be detrimental to the health of the child. We got kids now being born, and you got them growing up, and they're not losing a lot. They're not burning fat, and you have obese children now. They're not exercising. A lot of them sitting in the house. They play video games, or they chatting on their phones, texting. That's another healthcare problem. And when I say healthcare, I'm leaning towards mental health there, because people don't even want to conversate anymore. When I say I'm talking about having a real conversation where you're looking at someone, talking to them, you hearing their voice, or you're on the phone and you're talking rather than punching letters in all the time, characters, building up sentences and sending them off. And let me tell you something. That was something in order to reach people when it's hard to get them on the phone to talk. But now we got people that they can't even hold a conversation, because all they know how to do is text. Another one, that's later on. That's another story. Moving on. Drinking too much alcohol. That is another thing that we need to be mindful of, African Americans, my brothers and sisters out there. We need to be mindful of how much intake of alcohol. I'm not here to preach to you, tell you you're not supposed to be drinking, blah, blah, blah. What I'm saying is consumption levels. How much? Back off. Pump your brakes. Remember, too much of it can raise your blood pressure at any given time. Don't base your body on someone else's. Everybody is unique. Everybody is unique. Remember that. Third one, the use of tobacco. We talked about that. I'm always going to talk about that. Okay? I'm going to always bring up the risk involved when you are smoking. Whether that's smoking, vaping, you name it, there are risks involved. Just like there's risk involved in getting out there, getting in your car and driving to work. There's a risk involved. I'm always going to talk about it, because I want us to have a careful mindset and awareness. Let's continue to build awareness. Tobacco can also cause damages to the heart and blood vessels. Not to mention what the nicotine will do in raising your level in the blood pressure. So, this is just something that you need to know. We need to know. We need to be aware of. you need to be aware of. Here we go. 4, my favorite, poor eating habits. We have this soul food thing that we put together dishes and da 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 da. We fry. Now I do know people that have started baking their meats and stuff like that. I do. I bake. I don't even know how to put stuff on the chicken to be able to fry it. So that's my thing. I'm a bake anyways. So if I eat a piece of fried chicken, it's like a wing, those little wingettes and those flats. I love the flats. But stay away from too much fried food because you don't want to eat things that is very high in saturated fats or trans fats and cholesterol. You want to stay away from that. This is about prevention now. We're talking about ways you can prevent this thing. And you can do it. We want to raise the level of awareness, and we want to make sure that we all stay alive as long as possible. How about that? Moving on to the next one that I have here is stroke. And this is something that even in my neighborhood, I even ran into that in a personal cancer and strokes. I've ran into that on a personal level, and it's not easy to deal with looking at someone that has had a stroke and trying to recover from it. Recovering from a stroke is very difficult, it's long, it's tedious, there are a lot of things you have to do. You can't cheat. You gotta do it in order to get back to nearly to where you were. You have to work hard. So why don't we start on the top end in the prevention stages and work against heart disease to where you end up having a stroke in the first place? Let's talk about strokes. It kills 4 times more blacks than it does whites. Okay? Blacks have almost double the risk of having a stroke than whites. Nearly 200,000 cases a year. And it's the 3rd leading cause of death among African Americans in the African American community. 3rd leading cause of death. You think about everything else that we done complain about the whole year of 2019 about what done killed black folk, but these are the big boys. And you can't even lay eyes on them. You can't see them. They're like ninjas, silent killers. And this is a lot of times what we do to ourselves if it's not hereditary. If you don't have some type of heart disease that's been passed down through generations and you develop it, it's because of your habits. So you can't blame other people for this.